So let me bring you some other question, like see what you mentioned about the clinical pharmacist and you are working as a team with the doctor and all. So this is what strikes in my mind, that so is there any problem arise with the doctor and all, like if you are suggesting a drug, or if there are some ego clash or anything will happen like that in reality. So because they have studied MBBS, and you are coming from a farm D, and you are more, you have more knowledge about drugs and all. So anything will be like as a working as a team, as you mentioned, I agree that, but still why he like some ego clashes and all will be happening, or yeah, in your experience anything such happened? So I would like to listen from you.
Yeah. So for this question, so a small correction first of all, I will not accept that there will be a ego issue, but there was a hesitation. Initially, when we came out, when we are stating that we can be part of your team, we can check the drugs what you are prescribing, we can correct that. So when we used to say these kind of things, doctors or the other healthcare professionals used to hesitate or used to doubt us.
Okay.
Is this graduates really have that kind of potency
Hmm.
to do all these kind of things? But as I've mentioned, in these 10 years, again, in this particular area, I have seen lots of changes. Doctors are accepting. Really, they are accepting. They are welcoming us to be part of their team. They are allowing us for the ward rounds. They are giving their prescriptions for checking. So I will give you one example. I cannot mention the name and all, but I will give you one example. Recently, I came to know in a very good reputed hospital, there is a department called as clinical pharmacy department. In that clinical pharmacy department, all the people will be PharmD graduates. Nearly in that one branch of that reputed hospital, nearly 10 to 15 PharmD graduates are in that department. So what is their job basically is, when doctor prescribes the drugs, the prescription will be sent to that particular department where PharmD graduates will recheck the prescription. If they counter sign on that, then only patient will be given the drugs. If the PharmD guy didn't sign, they are not giving the drugs. See, this is the change what I am talking about. In 2014, it was not like that. They used to hesitate, they used to question us, they used to doubt us. But now the situation is not like that. Doctors are welcoming us. Really, we are very happy that we are able to be a part of their team. We are able to deliver a better patient care. So, without any doubt, right, I can tell you that in hospitals, big reputed hospitals, they are recruiting PharmDs. Doctors are allowing us. So slowly the things are changing, right? We are able to do many things in the hospital, and we are able to provide the better healthcare for the patients.
Okay, okay. So thank you for that answer also. So things are getting evolved nowadays, and so they are participating in all these kind of activities. That is happy to hear, because I heard that in abroad and Western countries and all, doctor will only do the prescription, and rest of the things will be taken care by the PharmD graduates. So provided the student who should they should have good knowledge. That's what I'm saying. We are circling back to that only. Whatever the exposure they are getting, from that only they can learn these kind of things. Otherwise, if he or she doesn't have any good exposure or a good college or faculties, then he can't do that work, right? That is one of the major things. So provided you can work there, but you should be very good at what you are doing, and you should excel in what you are doing. Then only you can, you can challenge, or if something is there, you should be confident enough to ask them, and then only that your knowledge will come into picture. So next question is, so when it comes to farm day, we have to pump in a lot of money, right? So
Yes.
most of the that is compared to the B farm or M farm, we have to pump in some money. So what do you think the salary, and I want you to be little frank about this, the salary and the output versus input, that kind of when we are checking that, how it will be, and I would like to listen from you.
Yes, definitely, Shamir. So, coming to the fee particulars of the PharmD, yes, as you have mentioned the input and output thing. Yes, there are, as I mentioned previously, there are 270 colleges which are offering PharmD course. In that, we have a very good topmost universities as well as least pharmacy colleges also. As you asked me to be very frank, I am telling you this, but of course, I cannot mention the names and all. As a PharmD graduate, I know that pain, right? By spending lakhs of rupees, what now we are getting. So, with that thing, I am telling this point also. So yes, there are some colleges which are taking lakhs of rupees, but how much the student is paying for that, maybe he is not getting back, maybe immediately also. So that's why what I am suggesting all the budding aspirants who really wants to join in this, who really wants to be in healthcare team. So select the college wisely, so which is having all the facilities. So my first priority, see, basically I'm from a university background, so I have completed my PharmD from Annamala University. So there, so we can select such kind of universities, old, right, good reputed universities where the fee particulars are also very less, but the thing is that you should have that capability to get the seat in such kind of colleges. For that, previously what as Shamir mentioned, you should have that proficiency or you should have that knowledge either before joining PharmD, and of course after completing PharmD also. Knowledge is very important because we are into the healthcare team. So yes, you can select from those many colleges. You can see all these different kind of options, and you can select a very good college which is offering this course for a good reasonable tuition fee structure. And you can also, so after completing PharmD, basically as I've mentioned, we have plenty of opportunities. Year by year the opportunities are increasing, packages are also increasing. So right now we are going into the companies with a decent salary, not very less than a MBBS graduate. A just MBBS graduate, what a just MBBS graduate is earning, almost that amount we are earning. We families are also earning right now. So I don't think we are earning very very less, but it is not maybe up to the mark, up to the standards of this PharmD course. That is what I can say. So again, PharmD has to reach, right, much more heights, right. It has to be considered. The PharmD graduates should be recognized, they should be used in different places. Then automatically the packages, everything, the output, input, everything will change, and the packages will also increase.
So I would like to add something to this, and what he mentioned is like true only. But there are see when we are choosing the college wisely, the thing is there is a opportunity to get placement also. So to the MNCs, and so they will pay you nicely. They will pay you nicely. MNC, whatever the pharmacovigilance or medical writer, clinical investigator, all those such sort of jobs. Definitely they will pay you nicely because the company has a standard and a pay scale. So it's not like this is the thing, and you should be very wise enough to choose a good college. Okay. So next, I would like to ask about PB entry. You mentioned about PB entry, but when I am saying that a student who is coming from B Farm after 4 years and who is going to study with this, who has been completely studying from the first year, this Farm D students. So any kind of difficulties they will face when it comes to this curriculum or subject and all those kind of things, like to pick the things whatever they have been exposed to. So I would like to listen that also from you.
Yes, definitely. So the students who are joining for lateral entry into PharmD course as post baccalaureate, obviously they will have many difficulties, or why? Because see, the PharmD integrated people in the entire PharmD course, there are nearly 40 subjects and all. So mainly we are dealing with therapeutics, pharmacotherapeutics, pharmacology kind of subjects in 2 to 3 years of PharmD. In integrated course, in second, third, and fourth year, we'll be reading this pharmacotherapeutics for 3 years, pharmacology for 2 years. Whereas PharmD PB people, they have to complete these three parts of pharmacotherapeutics only in 1 year. So that is the main task for them. It may be the difficulty what they can feel. So in the first year of lateral entry, yes, they have to work more harder than the PharmD integrated people. Why? Because these people will be learning that subject in 3 different years, but the same subject they have to study only in 1 year. So apart from that, the remaining things, of course, yes, they will be already they have completed B pharmacy. Some subjects will be similar, both in B pharmacy as well as PharmD. So coming to the other subjects, they may not feel that much difficulty to understand, to cope up, and to come into the track. But only in these a few subjects they may find difficulty. For that, obviously, what I can suggest is that the student has to work more harder. As he has chosen PharmD, before choosing PharmD only, anyone has to think about all these things. Can I do PharmD? Can I have that interest? Do I have that interest or not? Because that this is very important. As a teacher, I can tell students only one thing: if you are really interested, as I have mentioned already, if you are really interested to work in the healthcare team, then only you join PharmD, because you have to work a lot. You have to be with the patients from second year onwards. You have to spend hours together. So that's why if you're ready for all these things, then come to the PharmD. Once you step into the PharmD, you have to, and especially the PharmD PB people, yes, they have to work more harder in the first year, especially to understand, to complete all these subjects without any backlog kind of things. After that, remaining everything will be same with the things. They'll also be going to the hospital for practical knowledge and all. Yes, everything will be almost similar.
So I would like to add one more question, like about the syllabus and the backlogs and all when it comes to the difficulty of this course. So and the internship you are saying 1 year, and what about any stipend or something we will get during that time or not? So this kind of questions also is there. So could you please explain about that?
Sure. Sure. So coming to the syllabus, as I have mentioned, there are many similarities between BPharm subjects as well as PharmD subjects. Similarly, we can have some similar subjects between MBBS and PharmD, especially the ecology kind of thing, clinical pharmacy kind of thing, therapeutics, human anatomy and physiology kind of things. So I don't go into much details about the subjects and all. So coming to the next thing I have to mention here is the one difference what we can see between B pharmacy, B Tech kind of examination pattern and PharmD examination pattern. Basically, PharmD examination is like yearly ones, yearly pattern, whereas the previous things I have mentioned, B pharmacy, B Tech, diploma, M pharmacy, everything is like semester wise. And in all those courses, if you have subjects, right, n number of subjects also, you can be promoted to the next year. You can complete them by the time you finish your course, or even of course after completing the course time period also, you can complete the backlogs, then only you will get the certificate. But there is a little difference with PharmD here. If you are having more than two backlogs in any year of this PharmD, first year to fifth year, you cannot be promoted to next year. That is the main difference what you have to understand. And the second thing is, if you fail in practical or theory, you have to write both again in supplementary examinations. Again, this is also one area.
Depends on university or
No, it is common.
okay,
It is common because PharmD is like PCI. PCI framed the structure, so
okay.
almost all 100% of the colleges have to follow, only with little amendments. But this is fixed. Every college has to follow this.
Okay.
So as per the PCI, Pharmacy Council of India regulations, this is the examination structure what PharmD is going through. So they have to clear the subjects immediately. If they have more than two, that is three or more than three, then they cannot be promoted to the next year. And one more thing is that before entering into internship, that means in 5 years, whatever the backlogs you are having, you should complete within 5 years only. If you didn't, you cannot be allowed for internship. If you are clear with all the subjects, then only you are eligible to start your internship phase. Otherwise, no. You have to be back in your home. You have to clear the subjects. Then only you will be allowed for the internship program. Then coming to the next thing, during internship period, so whether these PharmD students will be provided with a stipend or not. There are many controversies on this. There are many issues happened. As a PharmD graduate, we have done so many. We have submitted many requests to PCI, universities, government people, but unfortunately, till now we didn't get a positive thing on this. Whereas if you see the MBBS interns during their internship period or during the housey, usually we call with that name housey. So in that period, MBBS students will be provided with intern with stipend, but that is lacking for PharmD. Even though we are doing internship for 1 long year in the hospital, in the same hospital kind of setup, almost similar to MBBS people, but still we are not getting that stipend. That is one thing what I can say in this entire structure of PharmD that is lacking still. So we don't have a stipend till now. We are waiting for that.
Yeah, hopefully it will come soon, I think, because you are working there, right? Internship means like unpaid job it is. According to me, it is like we have to work more in internship also. And so when it comes to PharmD, most of the students are asking me one question that abroad, can I go abroad? What is the scope in abroad? So I heard also, I don't know about that much. Some countries made PharmD as, the basic pharmacy degree, and there is no D Pharm, there is no B Pharm, anything like that. If you want to be a pharmacist in that particular country, you should have a PharmD degree. So I would like to listen something. You have to put some light on that topic also.
Sure. Again, this is also one important area and most commonly heard thing also. Usually, from my time onwards, when I have chosen, when I'm going to join PharmD, I have also heard the same things that in India, as it is a new course, it may not be that good when you complete your PharmD, but as it is already existing in many countries like US, UK, Australia, New Zealand, whatnot, almost in most of the countries, PharmD is a very good established course from many years. As I mentioned in the beginning of this video, almost from last 50 to 60 years, this course is existing in some countries like USA and UK. So yes, coming to the opportunities or who are eligible, yes, all the PharmD graduates, they are eligible to go for abroad and they can select plenty of courses there. So the thing is, the main drawback uh, till last 2 to 3 years, the main drawback is that we cannot go abroad to join a job directly. So obviously after completing PharmD, again as a student, we have to go there, we have to join in some course. Like that may be a diploma in courses or master courses or MBA or again PhD also. So this is the only option what we had almost till last 2 to 3 years. So we used to go on the name of student visa. We used to again join in some MS courses and all. After completing that MS course, we used to get a job there. Most of the family graduates, they are doing jobs there till now. Even my students also, nearly 30% of my students in 10 years of my experience, they went to abroad, they have completed their masters and they are doing job. Coming to the next thing, is that true that only PharmD kind of course or such kind of course is the only thing which is getting accepted in other countries for getting into some pharmacy related jobs in other countries? Means yes, but not completely. So again, till last 4 to 5 years, it was like mentioned in US. If, for example, if you take US kind of thing, they used to say that 5 years of pharmacy degree students, 5 years of degree students only, they are eligible to be considered as a pharmacist or completed an equivalent pharmacy course. Because in US, the pharmacy course is like 5 years. The PharmD, whatever I'm talking about here, we are having 6 years of course here, 5 years of studies and 1 year of internship. So there in US, that is of like 5 years course. So they have mentioned, many of the universities, they have mentioned that they will accept the students who are equivalent to that kind of 5 years course. So now what is that equivalent course in India is nothing but PharmD. So that's why usually most of the people used to think like that only Pharm D is the pharmacy course which is eligible or which can be accepted in the other countries, but not like that. Even after completing M pharmacy also, they can go to other countries, they can get some good opportunities. But one thing what I can highlight about a clinical pharmacist or about a PharmD graduate is the position what I am mentioning, clinical pharmacist, that is made for a PharmD graduate. So no other pharmacy stream people can easily go there and get a clinical pharmacist job. But for the PharmD graduate, it will be easy because he has completed already internship. He has already trained in the hospital setup. He is well trained in all these areas. So he will be the first prioritized person to be selected for the clinical pharmacist position in other countries. But getting clinical pharmacist job in other countries is not that easy what we are hearing. So simple statement what you guys will hear from your friends or from your family members is PharmD is very good in other countries, PharmD is not good in India. No, it is not like that. It is not easy to get a job in other countries also. As I have mentioned, almost till last 2 to 3 years only on student visa we should go there. After completing MS, whatever the MS program we have completed, based on that only we'll get a job. If we get a job, we have to do, otherwise we have to suffer a lot, we have to search for the jobs and all. And the clinical pharmacist job, which is the main thing for which this PharmD course is introduced in our country, for getting that clinical pharmacist job you have to clear nearly 4 to 5 examinations in that country, sitting in that country. We cannot write those exams sitting in our country. So we should go there, we should clear those exams, and we should complete internship also in that particular state of that particular country. Then only if you clear all these things, then you will be eligible or you will be recognized as a registered pharmacist in that particular country. After that, again same, you have to search for the jobs. If you are selected, then you will be working as a clinical pharmacist, otherwise the same thing. So in my opinion, the career opportunities, the way of opportunities are almost equal both in India as well as in other countries. Only the difference what we find is like the amount what we are building in other countries is more compared to the amount what we are building in our country. That is the only difference. But the same kind of jobs, the same pharmacovigilance, the same clinical research, the same clinical pharmacist, everything is same. So again in this context also, think wisely, take the decision wisely. If you are able to go to abroad by spending the time and lakhs of money, go there, study there, join in some course, study there, try hard and get some job. Otherwise you can be here. As I have mentioned, plenty of opportunities are coming in India also. You can get good jobs here as well.
Thank you, sir, for that wonderful answer. So, what he mentioned is absolutely true because you can't simply go abroad and straight from the college you won't get any job. For especially medical students, it is very difficult. You have to go there and do some course. Then only they will accept you and clear n number of examination. Anyway, it is not a cakewalk. Studying is also not a cakewalk. Getting a job is also not a cakewalk. After getting job, working is also not a cakewalk. Nothing is easy in this world. We have to struggle, we have to work hard. Everywhere it is like that. People will say after studying you will get a job and it will be easy. After getting job also life is not easy. There are only trade-offs. There are no solutions. We have to sacrifice something. You have to spend money. If you want to go abroad, you have to pump in some money, lakhs. The consultancy, all those kind of things. Straight away they will not hire you anywhere. So this is the crux of this abroad related things. And sir has, I think, one more point to add. He will add that also.
Yes. So coming to the abroad opportunities, actually, what I was saying before, we don't have a straight option to go there for joining in a job, but that has changed. So from the last 2 to 3 years, that has changed. Some countries. So I can tell you the example also. Australia, they have opened the opportunities straight away. We can sit in our country, we can write exams, we can go there and we can join as a pharmacist, the two government related pharmacists in Australia. After Australia, again New Zealand, Canada, and some more countries also started accepting the PharmDs as well as B.Pharm or M.Pharm people also. They're accepting these degrees. They are asking the pharmacy graduates from other countries to come to their country and to clear the exams to work as a pharmacist. So this is one area again where you can choose. So previously there is no option for going to other countries directly for a job, but now that kind of opportunities are also growing nowadays. As I've mentioned, Australia and some other countries, you have to clear 1 to 2 exams by sitting in our country itself. But after clearing exam, you should go to that particular country. You have to do a small period of internship. Then you will be completing everything required for getting a job, and straight away you will be appointed as a government based pharmacist. So this is one a very good opportunity that what I feel. So to my students also, I usually suggest this kind of things.
So the weather is not that much favorable for the interview, so I have to stop the interview, and it is raining and it's too difficult to shoot also. So still we are doing that for our audience and our subscribers. So we were discussing about that abroad opportunities. He will continue, and after one more question, we will wind up this interview. And sir, over to you.
Yes. So continuation with that. So as I was saying about these Australia opportunities in other countries, right opportunities for joining in the jobs. So as I've mentioned, we have to write a exam CAPS. So for example, if you take Australia as an example, CAPS is the exam which we have to write. We can write that exam sitting in our country, but after clearing that exam, we have to complete a small period of internship in Australia. After that, you can become a registered pharmacist in that country, and you can start doing your job there. So that kind of opportunities are also increasing now. So my one suggestion to the students who have completed their PharmD is like, do not waste money simply spending your money for doing MS to going some other countries. So these kind of opportunities are also increasing nowadays. So try to consider this. You can save your money, you can save your time. Just by spending 1 year of time, you can clear all these exams and internship and all. Straight away you can start earning, right? So this is also a very good option which is increasing nowadays.
So with this note, we are going to conclude this interview. So what do you have to tell to the young buds? For example, a student who is going to the first year of PharmD. So in a short words, so we are going to wind up this interview. What do you want to tell to them?
Yes, so for the students who really wants to join in PharmD, as I have mentioned early in the starting of the video, those who are really interested in this particular subject, those who wants to work in the healthcare team or in healthcare setup, please do join. You can join. You will find that this is one of the best alternatives or best course where you can get good jobs in healthcare team. And coming to the suggestions or my opinion about the students who are completing their course, who are becoming graduates with PharmD. So as I was mentioning, you can choose any option that which are available in our country, or if you want to pursue any higher studies. So my suggestion is just as mentioned just earlier, do not waste money simply. So choose the course, choose the country properly, and follow your passion. So first of all, I try to identify why you have taken this PharmD. Most of the people, they'll take PharmD for working in the hospital to do something for the patients. So if you are really into that, you can do the similar kind of courses. That may be a master's program, or that may be a PhD kind of thing. You complete such kind of courses, go into that particular area, so that you'll have better future. You can shine in your career in terms of both, in terms of the designation or professional wise, and in terms of money also. So everything we can get. So only my suggestion is that come to the PharmD with utmost passion. During PharmD course, gain the knowledge completely, involve in all the theoretical, practical, hospital related activities, complete your PharmD. After completing PharmD, choose the right option and shine in your career. Thank you.
So thank you so much, sir. We are shooting this video in a rainy time, and lots of efforts are there. So if you find this content useful, you have to share to the aspiring, PharmD graduates, and you have to press the like, and you have to support me. So thanks for giving this much of detailed information. The weather is not favorable for shooting also. So thanks for watching, guys. We'll see you in another video. Thank you. Bye.